Welcome back to another amazing episode of the Marketplace Pastors Podcast. We are rocking and rolling with season 3, and it's all about self-care practices and strategies for busy leaders and entrepreneurs. And today, I am inviting back another amazing co-host to the boardroom, Dr. David Lee. You know Dr. David Lee. He is a doctor of public health, a doctor of chiropractic in the state of Georgia and in Florida, and he is the founder of Elevate Health Clinics in Woodstock, Georgia. Elevate Health Clinics is a whole body health restoration and maintenance center that uses science-based nanotechnology with cutting-edge equipment and techniques that integrates the best of modern balancing modalities, quantum physics, and nutritional support. At Elevate Health Clinics, we believe that it is the synergy of all the balancing modalities together that provide the miracles we see daily. Not just one procedure, device, technique, or profession. Dr. Lee is also a happy husband, father of 3 children, plus a son-in-law, and grandfather of 2. I want to say welcome back to the Marketplace Pastors Podcast, Dr. Lee. I am so excited to be having this conversation with you today.
Thank you so much.
Man, we had an amazing episode and it's been a really big hit. And I love the fact that we captured this essence in season 2, episode 8, Integrative Health and Technology. And a lot of people, when I say, hey, they tell me about pain they're having in their wrist or pain they're having in their shoulder or any issues that they're having. I like, oh, have you ever heard of nanotechnology? We have a clinic in North Georgia that can help you with that, right? And the first thing people say is, what in the world is nanotechnology? So I'm so glad you asked. So I'll send them the episode, just to learn. And hopefully from there, people will reach out and schedule a consultation to really get the help and support that they need. And on episode 8 in season 2, we talked about addressing the root cause of disease and how it's critical for holistic healing. We talked about the 3 R's, restore, recharge, and renew, and how they're essential for maintaining optimal health. We also talked about how to understand the incubation period and the healing phase of disease and how to identify and address, health issues that may come up. We also talked about, structural, chemical, and emotional aspects of health and how it's necessary for a comprehensive treatment, right? And so we dug into this on this episode. So we want to definitely recommend that you circle back, take a listen to that. It's very insightful. And then after you've had a chance to listen to it, please schedule a consultation with Dr. Lee. You will not be disappointed. For today's episode, however, we want to talk about perinatal wellness strategies before, during, and after pregnancy. Dr. Lee is a Webster certified chiropractor, which means he can specifically specialize in pregnancy as well as in infants and newborn care. And so I wanted to have this conversation with him today because one of the things that I push for in the community, in my education as a full spectrum holistic doula, is to help women get healthy before, during, and after pregnancy. And so we've heard a lot on the news. We were seeing a lot that, this whole maternal health epidemic, particularly in Black birthing people, has been just astronomical. And one of the conversations that we're having in many rooms is, what do we do about it? And so there are many things that are happening behind the scenes right now to kind of help impact this maternal mortality rate, particularly in the state of Georgia. But one of the things I am just convinced of, and I believe that Dr. Lee will agree with me, is that being able to identify any pre-existing health conditions before pregnancy will be the game changer. one of the things I've leaned into very heavily is developing a reproductive health plan. So if you are considering getting pregnant in the near future, you're like, I want to have children. This is a part of my plan, but right now I'm finishing school, or I'm trying to really solidify my career, or I haven't gotten married yet, but I'm believing God for marriage and I'm believing God for children. We really want you to lean into this conversation and take into consideration some of the strategies that we're going to offer today to develop a reproductive health plan. If you are already pregnant, this conversation is for you as well. We want to talk about what it looks like to be healthy during pregnancy to make sure that your outcomes in labor and delivery are superb, right? We want to see moms have healthy babies. We want to see them be strong. And so even if you're in your postpartum period, maybe you just had a baby and you're experiencing some back pain, or you're experiencing some, emotional turmoil, or your hormones are up and down. All of the tips that we're going to offer today are going to help you be able to navigate this perinatal wellness space. So Dr. Lee, let's lean into this conversation. Do you agree that developing a reproductive health plan, meaning getting healthy before pregnancy, will improve birth outcomes?
Most definitely. The first conversation I have with a prospective parent is about their health now. The most important aspect you can have to have a healthy outcome of pregnancy, a healthy delivery, and a healthy baby, a healthy life, is to be healthy yourself before you. Things that we do, how much water you consume, whether or not you do a lot of caffeine, a lot of alcohol, what your sleep patterns are like, what your disease processes are like, what your rashes are, what your sensitivities are, with your food allergies. All these things will be carried through. They'll be exaggerated during the pregnancy if you're not careful. Even if you have no symptoms before pregnancy, if anything is out there hiding, it'll show up.
Is there a tool or that you use in the office to kind of help identify some of these symptoms or pre-existing health conditions?
Absolutely. We use Spectre Vision Insight. It's a computerized device that actually makes a pseudo clone of your body on the computer, so we can study the body, find out what you've been exposed to, what you're susceptible to, what you might be allergic to or sensitive to, and processes in your body that are working subpar. Areas we want to concern ourselves.
Mm-hmm.
The number one cause of postpartum depression is somebody who is exhausted and their adrenal glands are tired before they get pregnant. But we can prevent that by fixing the adrenal glands.
Mm-hmm.
Much easier to dig it out during the pre-planned period.
Mm-hmm. Mm-hmm.
And another example might be.
No, I was going to say, do you find that to be a standard that a lot of people that suffer from postpartum depression have exhausted adrenal glands? Is that like what you see as on a consistent basis?
Yes, ma'am. It's so common. You're running around doing a career, being busy, being a new mom, still trying to keep your career going, and you didn't take a break before you started your career as a parent to get your body right first. And you suffer, and your child suffers, and everybody suffers. Because if you're not only adrenally exhausted, your child makes for a fussier baby, an unhappy life, lack of sleep.
Absolutely. So women who get the recommended healthcare services, who identify any pre-existing health conditions, even family history plays a very important role in having a healthy pregnancy. They're more likely to be healthy during their pregnancy and to have healthy babies. And so my commitment to you, Dr. Lee's commitment to you, is to develop what we call a pre-pregnancy care plan, or a reproductive health plan. That's what I call it. So if you're thinking about starting a family today or within the next 3 to 5 years, it's time to prepare now. Don't wait until you get pregnant, to start. I mean, if you have to wait till you get pregnant to start, it's not too late. But ideally, what we're saying is we want to kind of bring that body into balance before pregnancy. One of the things that I see a lot as a doula is that exhaustion piece. You go from that extreme high during labor, right? You're just excited about the baby, the new baby is here, and then there's a crash. That's usually when I get the calls in postpartum. We're happy, we got through the labor, And now mom's not sleeping because she's nursing every 2 to 3 hours. And maybe she doesn't have the support at home that she needs. Or, maybe we're having a hard time putting baby on a sleep schedule and things like that. And so what I find oftentimes is that sleep deprivation really plays heavily into that postpartum period. And so are there things that a woman can do when she's nursing to kind of help regulate her nervous system and her adrenal glands while she's nursing?
Absolutely. Probably the most important thing is become very efficient with your food. Some foods are more efficient than others, even based on your blood type. The definition of an inefficient food by Dr. Lee is any food that you eat that requires more energy to digest the food than you get from the food. So we're not talking about anybody eating a lot of junk food or candy or something like that. It can be really good food, but if it's not efficiently being processed by your body, you're starting off with a negative to begin with. Another
Mm-hmm.
thing you might want to test before you have your child is MTHFR, the mother gene for methylation. And it allows your liver to take the food you eat and convert it into energy in the cellular level. If you have a deficit in MTHFR gene, it makes it more difficult for you to methylate your food. It makes it much more challenging to get the right foods in at the right time. These are all things you want to ask your body before you get pregnant so you can know how to plan and be in advance. Another aspect is the same thing about nursing mothers. You as a doula know that you have to toughen up the body to get ready to nurse. If you don't use your wash rag technique, and you can explain that to the ladies later, if you don't use the wash rag technique to toughen up your breast before you start nursing, if you let everything go until the morning the baby arrives, then you're in trouble because then you got soreness, cracking, pain, you can't nurse, the baby's unhappy, the baby's hungry, the mama's unhappy, the mama's in pain.
Absolutely. So the key here that I'm hearing is planning for a healthy pregnancy, actually having a healthy pregnancy. So let's lean into that conversation right now. So mom has prepared her body for pregnancy. She's identified any pre-existing health conditions. She's identified family history. We've brought the body into balance through several modalities because we know it takes a combination of modalities in order to bring the body into balance. Now she's ready to conceive. We've addressed any fibroid issues because we know that that is a major issue as well to fertility, which is a whole nother conversation for another day. And we'll maybe have Dr. Lee and another person that I'm going to invite in to have the conversation about fibroids. But mom is healthy. She's ready to conceive. Now she conceives. What does that look like for a mother who is pregnant? How can chiropractic care help with pregnancy? What modalities do you have at Elevate Health Clinics that could help a mom that is expecting a baby?
One of the most important things is body health, is it changes and changes shapes and changes function as you grow in a pregnancy. It's very important to make sure the nervous system is working properly. Chiropractors are brain doctors, nerve doctors. They're not back doctors. So many people think of a chiropractor being a back doctor because they pop, snack, crackle your back sometimes to make your back feel better. That's only 5% of what chiropractic is about. Chiropractic is a brain doctor where the brain talks to the body and the body talks to the brain. That's via the nervous system. If your nervous system is not communicating, it's not communicating from mom to baby, and the baby is inside depending upon mom 100%. So it's very important to make sure you maintain that throughout the pregnancy. So weekly visits to get a spinal checkup is a good idea all the way through the pregnancy, preventing things that might necessarily be complications during birthing because the baby didn't develop 100% or didn't turn correctly, not in the right position. Same thing goes with exercise. Most ladies do much better if they're exercising all throughout the pregnancy. But after you're pregnant, my wife was a kickboxer. She did kickboxing 3 or 4 days a week for an hour at a time, sweating with the oldies, kickboxing with music, did all the way through the pregnancies, before, during, and after. So her body was in great shape. But if you start kickboxing class at 3 months pregnant, it would be detrimental. So starting an exercise program at the same time you decide, I think it's time to have children, is a great idea.
Absolutely. Absolutely. It's so important. It's so, so important. I even find that delivery outcomes for mothers who are physically active before pregnancy during pregnancy have shorter labor times, meaning it doesn't take as long, even with the first baby. I am literally seeing, I have actually quantitative data now because I've actually seen it. Moms who are not physically active and then they try to start getting active during pregnancy, but maybe they don't really stay consistent with it. They have long labor times. My moms who are fit going in, fit during pregnancy, have marathon short births, right? It's like they can lock in mentally, they can labor through it very quickly. Their bodies are very relaxed during the laboring process, and baby comes out, right? Fetal injections, most of my runners, a lot of my runners, I find that their babies come out like through the fetal injection very quickly. They're very strong, during the laboring process. And so we cannot stress this enough. Not only is your nutrition important during pregnancy, but your physical fitness before and during pregnancy is super important. A lot of things that we see during pregnancy is extreme weight gain, preeclampsia, right? Puffiness, fatigue, all of these things. And I honestly believe, and you heard it from Dr. Lee as well, that having an exercise routine, making sure that you're eating right for your blood type, all of these things are really important during pregnancy, even for your baby as well. Dr. Lee, does anything else come up for you when you're thinking about pregnancy? And then we'll kind of talk more a little bit about the postpartum period.
Schedule of your life. So many people I've talked to over the years saying, well, I'm going to work until I go into labor. I'm going to be busy, busy, busy. I'm working 12-hour shifts. I'm working 8-hour shifts. I'm working 6 days a week. I can take 6 weeks off. I'm so excited that I'll have 6 weeks off to have after my baby's born and things like that. That's not the schedule that you want. Because what happens is your body's on go, 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 go. Plus we're feeding for 2. Then we go into labor and my body is so exhausted that the 6 weeks postpartum, when you're supposed to be enjoying your new baby and things like that and recuperating from the delivery, just becomes a body exhaustion wipeout. Or they might need more like 6 years to recuperate. So getting your schedule down to what it's going to be like when you have a baby is much better to do about month number 6 or 7.
Mm-hmm. Absolutely. Absolutely. I 100% agree. That adrenal fatigue, that nervous system, the adjustments, all of that are really, really important. And I really want you to reach out to Dr. Lee to make sure that you schedule an appointment just to make sure that your body is well, whether again, you're preparing for pregnancy, whether you're already pregnant and you just want to say, man, I didn't get it early enough, but what things can I do now that I am pregnant to make sure that my outcomes in labor and delivery are superb? Let's talk a little bit about the postpartum period, and we'll round our conversation with this. We have a mom who we know has had a C-section. We're going to look at 2 options, mom that had a C-section and mom that had a vaginal birth. We know that in the C-section period, it can take 8 weeks of recovery. And with vaginal birth, it can take 6 weeks of recovery. What protocols do you recommend for the mom that had the C-section and the mom that had the vaginal birth?
Really important thing with C-section, understand that scar tissue actually fades with age. So the ugly mark on your belly that you're all freaked out about after the first C-section starts to fade with age. So by the time you're 40 years old, it's just about gone or almost invisible for most people on the outside of the body. But on the inside of the body, the scar tissue actually grows like a tree root system. It starts to envelop, grab a hold of your colon, your bladder, your uterus, causing all kinds of havoc. So you want to start working on the scar tissue 6 days after the delivery, utilizing things like low-level cold laser, percussion, lymphatic massage, things like that to regroup your round ligament, get your scar tissue supple, relaxed, and your muscles all realigned in your abdomen again. You don't want to wait until your baby's 2 years old before you decide you want to put a bikini on again, and now it's time to work on the scar tissue after delivery. Same thing for a vaginal birth. In case there's an episiotomy or something like that, you want to start working within a week. Pay big dividends, save your range of motion.
We also highly recommend working with the pelvic floor specialist as well in that postpartum period, right? What are your thoughts on that?
Exactly. One of my patients is an OBGYN and talks about that freely, saying that pelvic floor exercises, sometimes there's some new machines out there that do it for you, or you can use expanders. Getting the job done now instead of waiting until you're 40 and you have incontinence or bladder leakage or pelvic floor falling out, crazy stuff. You want to make that part of your routine. Even during the pregnancy, you can do some of this stuff. Get prepared for it. Helps with delivery, makes things happen quicker, faster, better. Makes the recovery time there and eliminates most of the time any of the bladder problems.
Mm-hmm. Yep. And a lot of women don't realize when they get up in age in their 50s and 60s that the reason that they're having the incontinence is because of the childbirth, and they never repaired it through pelvic floor exercises, correct? Isn't that what we see?
It's exactly what's going on. Just because you don't have any bladder control problems after your first baby's born doesn't mean that 20 years later it's not going to happen.
Mm-hmm. Mm-hmm. Fix it now. Fix it now. Well, this has been very insightful. I am so grateful to have you as a friend, as a colleague, as a practitioner for myself to keep me healthy. Y'all, Dr. Lee makes sure that I'm good. I go in for my visits too. And he's like, what's going on with you, child? Like, your body is screaming at me. And I'm like, I haven't had any sleep and I'm not exercising. He's like, I see, right? And so it's good to have a wellness team. It's good to have a care plan, again, before, during, and after pregnancy. And you can learn more about Elevate Health Clinics. The links are in the show notes. And of course, you can visit yourdivinedoula.net to learn more about how we support moms with getting healthy before, during, and after pregnancy. Dr. Lee, thank you so much for your time today. I know you've had a long day of service to the community, but thank you so much for making space. Absolutely. Absolutely. I'm going to stop the call. Thank you for tuning in for another amazing episode of the Marketplace Pastors Podcast. We'll see you in the studio. Cut. We'll see you in the boardroom next time. Have a great day.